We're protesting today because Oklahoma Health Care Authority in just a few short days is going to be voting in the largest restriction on mental health that the state has ever seen. And because so many people will be affected by this, it's about big business, and there is no shortage in funding. They are saying that under the shroud of funding, but it's not. They are just trying to filter the money from the private agencies into the community mental health centers who aren't providing the services that the private agencies are providing. They want to pay the community mental health centers much more than they are the private agencies. They're trying to do away with a lot of clients that are in need of the services that we are providing, and a lot of people are going to go out without needed services. We've been very fortunate in Oklahoma to not have any school shootings, and we want to keep it that way. We don't want to be like other states. We want to, even though we are in the bottom 5% nationally, we don't want to be there. We want to take care of our children, and we want to take care of our citizens. We want them to have the mental health services that they need. Oklahoma Health Care Authority is proposing to restrict the psychosocial rehab services. That would be so restrictive that more than 80% of the people that are currently receiving these services would no longer be able to receive them. And basically what that service is educational services. We can teach kids how to deal with ADHD. We can teach on domestic violence. We can teach on parenting. We can teach on communication. Without that service, these kids will go without those services. These parents will go without those services. The psychosocial is dependent upon the psychotherapy, okay? The licensed behavioral health practitioners are responsible for doing assessments and intakes, treatment plans. Psychosocial rehab people cannot do that. They are dependent upon the LBHPs, and there's just not enough LBHPs to perform the services at the level that we are currently performing these services. These psychosocial rehab people will be basically unemployed, and the people that they're currently servicing will no longer have therapists. What are these clients going to do without their therapists? What are they going to do without the services? The psychotherapy is something where they can identify and process their feelings and the issues that they've had in their past and are currently dealing with. The rehab individuals are the individuals that teach and educate and instruct on how that affects them and what they can do today about it. I suggest that the Department of Mental Health lower the rates for their case management to meet the rates that the outpatient behavioral health centers have to operate at. They shouldn't be able to get $16 for 15 minutes where we get $10 for 15 minutes. Make everybody get the $10. Make it even, and then we don't have to do away with the services. People can continue getting their counseling. I just want the public to be informed of what's going on, and I want them to call OHCA and say no to this rule change. It's not good for the state. We're going to see a huge impact in our communities on mental health.